So joining me now to discuss is Paul Larkin. He's a senior legal research fellow at the Heritage Foundation. Thanks for being here tonight, Paul.
It's a pleasure and an honor to be here.
Great. Thank you so much. So new figures, as I'm sure you've seen just from last year, show that a record 93,000 Americans died from a drug overdose in 2020, 75% of which involved opioids. Why do you think we're seeing such a tragic spike in these types of ODs?
Well, you mentioned the right word. It's fentanyl. What's happening is China is manufacturing the final product, or it's manufacturing the precursor chemicals. One or the other then gets shipped by and large to Mexico, and the cartels then transport it across the southwest border into the United States. It is coming across in increasing amounts because it's very easy to smuggle. It's easy to smuggle because it is so much more powerful than other opioids. You only need a small amount of space in a car, a truck, or in a backpack to get a sufficient amount across. The cartels are making money off this, and people are dying. And unfortunately, this administration is not doing anything to stop it.
I just have to ask you about these contentions that I've been hearing by all the blue check marks on Twitter and by fancy, smancy professors saying, oh, just, breathing in some of the fentanyl or having it go across your skin at all, having that type of exposure. They say that's not enough to put you at any risk. What do you make of that situation?
Well, if it's by people who are not unfamiliar with this particular drug, you can at least attribute that to lack of knowledge or ignorance. But if they're aware of how deadly fentanyl and its analogs can be, then it's irresponsible. Let me give you an example. Morphine is the basic drug when you're talking about effectiveness. It gets a score of 1. Heroin is 5 times as potent as morphine. Fentanyl is 50 to 100 times as potent as morphine. And one of the fentanyl derivatives, carfentanil, is perhaps 10,000 times as potent. It's used as a tranquilizer on elephants. And a small number of grains, not grams, just grains, maybe 5 or 6, can be fatal. So it doesn't take very much in order for somebody to OD, because it immediately goes from the nasal passages into the blood system directly to the brain, and it goes to that portion of the brain that controls the autonomic respiratory function. Once that shuts down and you pass out, unless someone revives you, you're not going to make it.
And correct me if I'm wrong, but from what I hear at least, is the reason why we're seeing fentanyl being cut and, say, marijuana, people still, even states like California where we legalize recreational weed, the illegal markets, the black markets are actually still up and booming. California's trying to bail out the legal weed companies now. But when it comes to marijuana or some of these other drugs, from what I've heard is that it's actually cheaper for a lot of these drug dealers on the side to cut it with fentanyl. And perhaps that's why we're seeing all these different types of drugs that people are using and they don't realize it's been cut with fentanyl. Have you heard anything about that? Is there any truth to those kinds of claims?
There is, but I don't think it comes up very much in connection with cannabis. Fentanyl is a white powder, and so it can be a cutting agent for either heroin or cocaine because it's indistinguishable in that regard. And sometimes it's added intentionally by the cartels in order to give their drug a greater kick. But keep in mind, it also can be added negligently or accidentally. When you buy a drug at a drugstore, it has been manufactured by a legitimate pharmaceutical company that uses standards for how these drugs are to be manufactured to be sure that it's pure. When you buy something that is ultimately traceable to the cartels, you're essentially playing Russian roulette. Because if they mix heroin and cocaine and fentanyl in the same area, some fentanyl is going to make its way into cocaine and heroin. There's been an increasing number of people who have tested positive after fatalities for fentanyl. And whether it's because the cartels are doing it intentionally or whether it's because the people they're using to package their drugs are doing it negligently or accidentally or whatever, it doesn't matter. You're at great risk if you use any of these sorts of drugs. Oh, and by the way, it's not just powdered form. The cartels are also using pill presses to press fentanyl into pills so that people who think that they're buying essentially one or another types of the pill form of opioids could in fact be buying fentanyl pills because you can easily sell counterfeit pills once you have the tools.
And so looking ahead to the future, what the Heritage Foundation calls our other epidemic that's going on now behind the scenes that not as many people are paying attention to, what do you think, if you had the Biden administration's ear, what recommendations would you tell them to take, especially when it comes, we know China, we know the southern border sitting wide open, I should say, that of course those play some big role. So what recommendations would you make?
I would make 4. Okay, first, we have to stop the flow of fentanyl across the southwest border. That means we're going to have to do more to stop the flow of people across the southwest border. The cartels control the flow not only of drugs, but of people across that border. And the people are going to be carrying fentanyl, heroin, cocaine, whatever. So we need to do a much better job in that regard. Second, Biden actually has to show some respect for law enforcement. The story that you mentioned earlier about the officer who almost lost his life because he came across fentanyl in the course of making an arrest or conducting a search. That is a tremendous risk that even 5-10 years ago, law enforcement officers, whether or not they were handling drug cases, didn't have to face. They do now. Third, I think we need to approach this from all perspectives. We need to do more in the area of treatment. But we need to be honest with the public about that. The problem is most treatment is going to be expensive, and it may not work 4 times out of 5. So we need to educate the public that it's worth spending that money and explain why. Now, it's hard to persuade politicians that something that isn't going to work 4 times out of 5 still needs to be supported. But unless you're honest with the people, you can't expect them to buy into it. Finally, and this is the most irritating of them all, Joe Biden wanted to be president, and he now is. It's time to start acting like president rather than the cheerleader for the Trotskyite wing of the Democratic Party. He needs to be president for all of the United States. I had an event on this not that long ago in which I ended by asking this question. How many people have to die before he decides to do something about shutting down the southwest border? The White House needs to think about that and answer that question.
Paul, I really appreciate your expertise on these matters. Thank you so much for joining us tonight.
It was a pleasure. The pleasure was all mine.